Hello everyone, welcome to the First Parents channel. Welcome to Menza. And as you can see, we have come up with another topic today, which is breastfeeding after C-section. And to discuss about the same, we will be welcoming an expert with us, Dr. Janvi Shah. She is an international board certified lactation consultant and addresses all breastfeeding issues of mother and baby by conducting antenatal breastfeeding sessions, home visits, and online consultation. Being a mother, she understands the importance of creating a strong and healthy relationship with the child, and breastfeeding is one of the most sacred and primary ways to establish that between a mother and her child. She has been serving in the field of pediatrics since 1911. So we welcome Dr. Janvi Shah. Hello, Dr. Jan. Sure. Thank you so much for joining us. And as you can see, it's like a really new topic for all of the listeners. So thank you so much for doing that.
Thank you. Thanks to you.
Sure. So can we jump on to the questions now?
Yes, sure.
All right. So, firstly, can you, Dr. Janvi, can you tell us that what is C-section for the people out there who don't know, who are not aware about it?
Okay. Normally delivery happens in two modes, right? One is vaginal normal delivery and one is C-section cesarean delivery. We can say in common words. Yeah. So, in C-section, no, they will cut the abdomen from the lower part and baby will be taken out. So this kind of delivery is called C-section. In that anesthesia and everything will be there. So it's really difficult, mother to do breastfeeding over that period. So I have chosen this topic today.
Right. So,
Yeah.
my next question to you is that is it possible to breastfeed after a C-section for a mother? Like, does the milk come?
Yes, definitely it's possible. Baby has come out, right? So each and every baby comes with their food. Actually, I can say in like comic way that we are over smart. That's why we are using that powder ka dibba or formula. I can say. Otherwise, all the species. Uh, it's like cow, buffalo, dog, cat, any species. Do they need that? No, right? Each and every baby in any species, each and every baby comes and do the breastfeeding. So it is a nature setting that each and every baby comes. However, mode of the delivery, it doesn't matter at all. But each and every baby comes with their food, so definitely yes, milk will be there, definitely will be there. It's called colostrum, which is in very less quantity, and it's behind the breast, we can say, in the back part of the breast. So it's difficult to pinch and see. If you are pinching and seeing, it's difficult to get, but when baby will suckle, it will come. It's for sure. After a 20, yeah, after a 29 or 30 weeks only, breast milk is ready inside the breast.
Right.
Hello?
Right. So,
Yeah.
may we know that when does the milk production starts in the
That's
mother's
what I
breast?
said. Yes. It's around 29 to 30 week breast milk is ready inside the breast. So after the 30th week, whenever the delivery happens, milk will come if baby will suckle.
Right. And no matter what the way the baby has been delivered.
Yes, exactly.
Right. And what are the preferred positions for breastfeeding?
Yes, that's a good question. Uh, for breastfeed C-section, in C-section there will be anesthesia anesthetized, right? Patient will be anesthetized, so they cannot move their legs. It's spinal anesthesia is given to the patient or mother, so they cannot move their leg. They have to do breastfeeding in supine position itself, or lying down on the bed. Baby will be taken in prone position, matlab ulta, on the between the breast. So baby goes to breast and can do the feeding in the prone position easily. However, baby can feed in 360-degree. Any position is comfortable for baby for breastfeeding. Just thing is, it should be a deep latch. so it will be comfortable for the baby. And once you are out of the spinal effect, you can move your legs little bit. You can go to the sideline position also, in which you can just do curvet at one side, we say na, like that you can turn to one side and you can breastfeed. It's very easy and comfortable position for almost all the mothers after C-section. And once on day 2 mother gets up, spinal effect has gone, then they can do the football hold, which is the best position for the after the C-section, because in that position this will not happen at all. Pressure on the stomach, pressure on the stomach or the stitches or tummy, you can say. In football position, baby will come on the sides, so it won't give any pressure to the tummy. So yes, supine, side lying, and football position. These three are the best position after the C-section delivery.
Right. And it is to be said that after C-section, the supply of the milk, it's a little less as compared to normal delivery. So is it a myth or a fact?
It's definitely a myth. As I told, after a 30 weeks, breast milk is ready in a quantity, whatever the baby needs on day 1. So important part is that you have to make suckle the baby, and it should be taken out. But after a C-section, we do delay in breastfeeding, and after the normal delivery, generally it won't happen because there is no that stress, no major surgery, only the some stitches in the vaginal area, and the mother will be comfortable. She will be eating everything, drinking everything, so she will be comfortable in breastfeeding, and baby will breastfeed within 1 hour. But in C-section, we are failing over there, and that's why this myth has came up. If we will do the breastfeeding on table, it's definitely possible. We do that. We do the breastfeeding in C-section on in operation theater itself on the table. Then no milk issue has occurred in a single mother also. So definitely it's a myth. The main thing is it should be baby should suckle the breast within 1 hour after the delivery. It should be whatever the mode of the delivery, normal or C-section.
Right. So basically, we should start breastfeeding our child at the first week of
First hour of
delivery,
life.
first hour of life. All right. And what are
Yes.
the advantages or benefits of starting breastfeeding early?
Yes, definitely. One thing that you will understand that after the C-section, milk will be there. I can breastfeed. That confidence matters a lot. If baby can breastfeed immediately after coming out, so definitely baby can breastfeed after that also, right? And even it has important role of smooth breastfeeding journey, because in the first hour of life baby will be highly active. I can say most active phase of the baby is first hour of life. So that is important. In that hour, if you will breastfeed, so baby you will have a smooth breastfeeding journey. Then another part is the colostrum, which should be given first to the baby. It's like we don't recommend the pre-lactal feeds, right? Like janam gutti or honey or something. So the colostrum first milk will be thick and sticky kind of milk, so that should be given to the baby, because it has lots of antibiotic properties, and baby will not suffer with any kind of infections, or even it will be settle the stress of the child. And even intestine will have that sticky lubricant kind of things. So it's very important to give the colostrum to the baby. So this you will get only if you immediately start the breastfeeding. And yes, even the transitional milk which comes on day 3 or day 4 or day 5, that will come early if we'll start breastfeeding early after the C-section. And yes, for formula, we say that it's like junk food. So you don't need to give the junk food to your baby. You can give your healthy milk, whatever the baby needs, which is prepared for the baby by the nature. You can give that if we will start early breastfeeding.
Right. So, firstly, the main thing is avoid giving formula milk to babies.
Yes, I literally use this word, that junk food, for whatever the pizza and pasta does for us, formula does for baby. I can say just gaining weight, maintaining the hydration, but it won't give the nutritions. It's not in that absorbable form what the breast milk will be giving.
Right. And what about the mothers who can't actually breastfeed because of some reasons or something? So, what would you suggest
Yeah.
to them?
Yeah. If mother is not able to breastfeed in like any kind of issue, yeah, like baby is separated from the mother, it's in ICU for observation, or baby is very small for age to suckle, or in that case, na, we advise to pump or hand express the milk. Maximum pumping will ensure that supply won't drop, and even that can be stored to the for the baby. If it is possible to send to the baby and give, that's well and good. If baby is on starvation or something, your pediatrician or neonatologist not allowing to give the baby, then we can store that milk and we can give later on. However, the colostrum has that much good properties as antibiotics that we use it as a medicine, and we just like if we are getting one drop also, na, we paint the mouth with the colostrum as a medication, and it is a best antibiotic for the NICU. So you can understand that how important it is.
Definitely.
Yeah, so yes, answer is you need to pump or remove the colostrum or milk with the hand expression or pumping, and it should be done too early, every too early, like baby breastfeeds. So it will maintain your supply also for future.
All right. And what about any last minute tips for the mothers to make it easier for them to breastfeed while after having C-section?
Yeah. First thing is be informed and prepare before baby arrives. Once baby will arrive, no, it is a very difficult phase for them, because sudden changes, handling the baby, night awaking, guest will come, they will just give some advices like it's wanted or unwanted. It doesn't, like, they don't bother about it, but they do. So before only, once baby arrives, no, the mother will not get that time also, even will be in stress or after a major surgery in recovery phase. So I'll suggest ki be informed and prepare before the baby arrives. While the last trimester of the pregnancy is best time to get all the information, gather all the information, and be informed for each and everything. Even second tip is speak to your doctor, your gynecologist, your pediatrician. You can talk and tell them that you want to breastfeed your baby within 1 hour, because even all the gynecologists and all the neonatologists don't have that setup of be for the thing. Lactation consultants will be there in all the setups. It's not like that. But if you will insist them, definitely they will arrange for you, because they know the importance of it. And if you also know, then it should go on, right? And you should seek support for each and everything. You can definitely seek support. Don't No need to be a superwoman, right? For each and everything, if you need something like feeding pillow, pump, you can ask with that support with the nursing staff or hospital. You can, for household work, you can do take support for cooking and everything, because C-section is a really a major surgery. It's not like simple kind of minor surgery. It's a major surgery, need rest for 2 months. And yes, but definitely you can handle your baby after the C-section. You can take the weight of the baby easily. It's not like that you should not lift the baby because baby is 3 kg. So it's like you can seek support. uh, One more is experiment with the different position before baby arrives, because what I told, there are multiple positions of breastfeeding which will ensure that your breastfeeding journey goes smooth and baby has the deep latch. It is important for the deep latch. So like cradle hold, cross cradle hold, football hold, supine position, sideline position. These are some breastfeeding positions. So you should know before the baby arrives, okay, what are the position, how to do that. You can practice that with a like a dummy or doll something. So it will be easier after baby, because we see this after a 3-4 days also mothers are not confident to just lift the baby. As a new parent, we can understand it's new for you, but I'll suggest ki at least you can do some experiment or practice with that. So once baby will arrive, you will be confident enough that nothing will go wrong. Yes. uh, One more tip is patience. Yes, breastfeeding needs lots of patience because it is a skill. It is a skill, needs practice. It's not like kai jadoo ki chadi, like you will get the information and you will be bang on, like you will be going smooth. It's not like that. So you need proper patience, practice, and then it will go for you smooth.
Right. And after doing so many sessions on breastfeeding or during breastfeeding week and doing so many Instagram lives and doing so many sessions on Mensa, one thing that I've understood is that awareness about breastfeeding, around breastfeeding, what techniques to use, and all of it, I think a mother should start preparing all of it while they are pregnant, not after the
Yes,
baby comes. So maybe
exactly.
when you are in your second or your third trimester, try to enrolling in any of these lactation workshops, seminars,
Prepare for
something, anything
breastfeeding
that would be
something.
helpful.
Yes, yes, yes. Even one more thing I want to mention over here, that if you will you will do feeding your baby after C-section immediately, na. If you will do first 2 days also, then it won't go in the engorgement phase on day 3 or 4, जहाँ पे like breast becomes torn and it's very painful condition. You will not face this. If you know this earlier, it will be really smooth journey.
Exactly. And it's okay to ask for help, everyone. So
Yes,
if you need any help, so just reach out to doctors, reach out to your family, reach out to people around you. It's okay to ask for help.
yes. And at the end, I'll say the 3 keywords for successful breastfeeding or smooth breastfeeding journey is patience, preparation, and proper guidance. These are the 3 words which includes everything: patience, preparations, and guidance. Proper guidance. Yes.
Right. So thank you so much, Dr. Janvi, for joining us today and clearing all those questions around this topic. I hope we did justice to this topic. I guess we have a question from Vicky.
Yeah.
How frequently baby should be breastfeeded? Why does child hiccups? Can you
First,
quickly just
how
answer that
frequent?
question?
Yeah. First is how frequently baby should breastfeed. It should be on hunger cues. Hunger cues are the signs जो baby will show you when they are hungry. And otherwise, it should be 2 to 3 hourly in approx time. And why does child hiccups? It's normal. They just hiccups as a reflection. So you can ignore the hiccups. It's nothing to worry, and don't do if baby is doing hiccups, then don't breastfeed or don't give water or something. Just keep it avoided.
Right. I feel like these two questions are like a vast topic to cover.
Yes, I
So,
do agree.
yeah. So thank you so much, Dr. Janvi, for joining us today.
Thank you. Thanks to you.
Looking forward to hear more from you. Bye bye.
Bye bye.
Thank you for watching. For more such videos, do like, share, and subscribe to the First Parents.